There is some little bit disturbance. Actually, in your syllabus, this being the first chapter, that is cell and cell organelle. Okay? And we discussed that why it is so important. Why we are going to discuss about the cell. What is the importance of cell related with the biochemistry. You already know that cell is basically a basis. If you know the definition of the cell, that is what? It is a functional unit of life. Understand? And these cells going to hierarchy level to maintain our organ system, tissue level by the, okay? So the one question comes in your mind, why we discuss about cell in our syllabus. Because cell is a basis and function unit of life. In the cell, many of the metabolic pathway are proceeds. Because I think all of you do some preparation about the NEET exam, and during the NEET exam, cell is also covered. Okay? So in the topic, we discuss about the cell and suborganelle of the cell and cell membrane. Okay? So, just if we take the introduction that why it is important to study it about the cell, that some cell organelle play a vital role, like electron transport chain, like glycolysis, like chemio-osmotic theory, some other metabolic pathways that are proceed in subcellular organelle, that are proceed in cytoplasm. Why it is proceed in subcellular organelles? Why it is proceed in cytoplasm? Due to the presence of marker enzymes. Due to the presence of marker enzymes which are participate in this metabolic pathway, which can regulate the pathway in different stages. Okay? So that's why it is important to study it about this cell and cell organelle. And you already know that cell play a vital role, cell membrane play a vital role, like phagocytosis, pineocytosis. Neurotransmissions, muscle contractions, not allowed. Allowed नहीं है जो. Nerve conductions, exchange of potassium and chloride ions in the muscles. In the muscles, these cell membrane to be called sarcolemma. So all these important vital functions are proceed by the cell. Okay? That's why it is necessary to study about this cell membrane, composition of the cell membrane, and different types of protein, different types of lipid which are present in this cell membrane. So some of the topic I will take so fast about prokaryotic cells and eukaryotic cells. I think all of you know about it. What is prokaryotic cell? Who will give the answer? Yes. Anybody else? Huh? Yes, membrane bound cell organelle is absent. It is called prokaryotics. Basically, in the prokaryotics, we talk about the nucleus. That is not membrane bound. True nucleus is not present. So this is some basic difference between prokaryotic and eukaryotic cells. And these questions may ask in your exams, and this little bit gives in your book that what is the difference between prokaryotic and eukaryotes. Okay. So in this topic, we are basically discuss about the cell, that it contains lysosomes, mitochondria, ribosomes, peroxisomes, and some other cell organelle. You already something know about it. What is the function of mitochondria? ATP generation. I am not asking about the another name of the mitochondria. I will asking about the function of the mitochondria. So what is the function of iron mitochondria? Production of ATP. So what are the uses of ATP? It's used for different metabolic pathways, utilization for different metabolic function of the body. Okay? Mitochondria, smooth endoplasmic reticulum, nucleus. What is the function of nucleus? It is a repository of genetic material. It contains DNA and RNA. That proceed a very important metabolic functions, that is central dogma. Central dogma process. It is not metabolic, but it is a process for the synthesis of proteins. Okay? So the nucleus play important role for central dogma process and for formations of new proteins, synthesization of new proteins. These smooth endoplasmic reticulum, rough endoplasmic reticulum, and Golgi zones, ribosomes. So every organelles, every subcellular organelles play an important role of different metabolic functions. Okay? So basically in the cell we classify living cells. It may be classified as prokaryotes and eukaryotes. Sometimes it is unicellular or multicellular by the number of the cells. And by the function and by different properties we can divide as prokaryotes and eukaryotes. How many students from Bengali board? You are understanding English? You understand English? Because I don't know Bengali, how to speak Bengali. I'm not from, most of the students know me, I'm not from West Bengal, I'm from Madhya Pradesh. Okay? So, basically, different molecular and functional organization of the cell, structure and function of cytoskeleton, and lastly, cell fractions and marker enzyme of different organelles. Okay? So classification, we classified three major groups: archaea, bacteria, and eukaryotes. It is basically prokaryotes and eukaryotes. So I will skip this topic because we already discussed it. If you students take a one reading of previous topic, which I will describe in the class, if you have So if you take a one reading of this topic, what is cell and cell membrane, you understand. Okay. So these are the 3D structure of the cells that contain nucleus and other things. So basically, differences, these questions is asked generally in the exam, what is the difference between prokaryotes and eukaryotes. Nucleus present, no defined nucleus is present, endoplasmic reticulum present, it is absent, chromosomes linear, circular, and cytoplasm contain various membrane-bound organelles such as mitochondria, lysosomes, peroxisomes, and Golgi apparatus. It is undifferentiated. Okay, these are the main differences between prokaryotes and eukaryotes. So, how many sub-organelles have double membrane? Which one? Mitochondria, endoplasmic reticulum, peroxisomes, chloroplast, Golgi apparatus. Peroxisome, what is the importance of these peroxisomes? These are very important function. All the biochemistry topic are mainly concerned with these cell molecules. In the whole year, we discuss about the different metabolic pathways which are proceed in the cell, different regulatory pathways which can regulate the metabolic pathway proceed in the cell, in different organelles, in the hepatocytes, in the nerve cells, in the sarcolemma, in the muscle cells and other things. Okay? Different protein synthesis are mainly occur in the cells. So we discuss about the tumor suppressor gene, we discuss about the cancerous cells. So what are the important things between this? A cell. Understand? So we can classify the cells in three major groups. The first one is plasma membrane. It is cell membrane. Okay. And second one is subcellular organelles. And the third one is nucleus. So if we talk about the cell membrane, it is mainly a composition of carbon, hydrogen, oxygen and nitrogen substances. It contains lipid molecules, it contains proteins molecules, and it contains cholesterol esters and some other biomolecules. To explain the structure, different types of theories are given. Different types of theories are given. Lipid bilayer theory, fluid mosaic model. Who can give fluid mosaic model? Singer and Nicholson. Okay? They give several types of theory to describe the functions of the cell. Why the cell membrane is rigid, why the cell membrane is flexible, they give his opinion. And in all of these theories, the Singer and Nicholson theory is being mostly accepted. Okay? So these questions asked in your exam, write about fluid mosaic model. Write about fluid mosaic model and explain about Singer and Nicholson theory of cell membrane. So firstly, student, you understand in the cell there is the presence of lipid bilayer. Lipid bilayer means just you understand this is two columns. You will sitting like a column 1 and column 2, and in between us this is the protein layer, and outer side is lipid layer. It is called lipid bilayer cell membrane structure. Most membrane composed of primary lipids and proteins. This is a basic important biomolecules which are helpful in the formation of cell membrane. Okay? Anyone can define what is protein? Anyone? Just raise your hands. From the last one. Very good. Sit down. Most of the students know about the protein, know the definition of protein, but due to less confidence, they are not able to give the answer. Just, I am not taking your viva here. But this is your first class. I know what you want. आपने अभी तक क्या सीख के आए वो मुझे पता चला. ठीक है? Proteins, lipid, it is a simple biomolecule that is composed of amino acid or different fatty acids. Okay, so these are present in the membrane. The basic structure of the cell membrane is lipid bilayer. You understand this? What is the meaning of that? It is like sandwich. The outside is lipid, in between proteins molecules are present. Okay, and after the giving theory, different theories are come. These concepts become more refined. These concepts become more refined. What is intrinsic protein? What is extrinsic proteins? Okay. Now this is the type of protein which contain these fatty acid chain which contain the lipids, and we call this lipid as compound lipids. We call this lipid which is present in the cell is to be called compound lipids. Compound lipids, it is a conjugation of lipids. Formation by two molecules. It is phospholipids. Phosphoric acid is the top of the group and fatty acid chain is attached to that. Okay? So which type of lipids are present? It is compound lipids are present and there is extrinsic carbohydrate molecules are present. Peripheral proteins means the protein which is present attached with the lipid layer extrinsically. And these are integral proteins. So this is general concept of the cell membrane. Okay? And these membrane referred as fluid mosaic model. The membrane mosaic is fluid because most of the interaction among its component is non-covalent. Living individuals, proteins and molecule free move laterally in the plane of the membrane. So the basic concept between fluid mosaic model is that what is the property of the cell membrane? It is rigid or flexible. Cell membrane is rigid or flexible. Cell membrane is flexible in nature due to the presence of cholesterol esters. And the proteins molecules are spread over the cell membrane like a mosaic. So that's why it is called fluid mosaic model. This is generally an important diagram and this when the question is asked in your exam, you will make this diagram that it contains cholesterol molecules, carbohydrates, glycoproteins, again a conjugated proteins which contain carbohydrate moieties, phospholipids and integral proteins. Okay? Proteins molecules in the membrane after do penetrate all the way through the membrane organize into actual pores for passage of specific substance through the membrane. So this is the meaning that membrane is a specific transport system. Why it is important? I will give the example in the previous class. That's who can enter in my class is mainly operated by this gate and we call this is a membrane. Only student can enter in the class. It is called selective permeability transport system. What is called? Selective permeability transport system. So this is the very important function of the cells that membrane can select a particular molecules to enter inside the cell. Sometimes these membranes contain a special protein molecule. We call these molecules as co-transport. Okay? And co-transport molecules can be active by some of the hormones like insulin, glucagon, which can activate the adenylate cyclase activities. Okay? So when we in the physiology, you will when faculty discuss about the transport system, transport mechanism of the cells, we already discussed. That's something important. Also, other membrane proteins are enzymes that catalyze different types of chemical reactions. Composition of the cell membrane. You can make your notes. Understand? Don't sit like a dumb. आप notes बनाइए अपने सेल्फ से जो पढ़ रहे हैं. Protein 55%, phospholipid 25%, cholesterols and carbohydrate 3% and 50%. Don't talk. Now lipid. It is mainly hydrophobic or hydrophilic lipids molecules that actually with the property with interaction of the water it can divide as hydrophilic and hydrophobic lipids. Okay. The phosphate end of phospholipid is hydrophilic and the free fatty acid portion is hydrophobic. What is the meaning of this sentence? that it contain we call this fatty acid chain attached with phosphoric acid. And with the interaction of water we can divide as hydrophobic and hydrophilic. Structure of phospholipids, it contains glycerol phospholipids. Glycerophospholipids. So different types of phospholipids are present. It may be divided glycerophospholipid and sphingnophospholipids. What is basically that? What is the meaning of glycerol and sphingnophospholipids? When this phospholipid having carbohydrate moiety of glycerol, it is called glycerophospholipids, and when it contain sphingol as alcohol group, it is called sphingnophospholipids. Okay? Now these are the structure, and cholesterol, which is mainly important for maintaining the fluidity of the membrane, which is interspersed between the phospholipid maintain membrane fluidity. Unsaturated fatty acid chain of glycerophospholipids bend to cis conformation from a pocket of cholesterol which binds to hydroxyl group in the external hydrophilic region of the membrane and it hydrophobic steroid molecule in the hydrophobic membrane core. That is basically there are two types of fatty acids are present in the cell. One is saturated and second one is unsaturated on the basis of bond present. In the unsaturated there is the presence of double or trial bonds in these fatty acids. In the saturation single bond is present, so on the basis of bond it can make flexibility, membrane fluidity. Okay, so this question asked in your exam also in the PG, who can maintain, which biomolecule can maintain the fluidity of the membrane, that is called cholesterol. Okay. Different membrane proteins are present. I can skip this because we already discussed about all this membrane. So in the cytoplasm we discussed one by one about this, all this important cell organelle. Endoplasmic reticulum, important. It is very important because endoplasmic reticulum can release different specific proteins which can important for the transportation of different lipid metabolism. Like HDL, LDL. HDL is what? High density lipoprotein. LDL is what? Low density lipoproteins. And these some of the specific transport are released by endoplasmic reticulum. Okay? So the endoplasmic reticulum is interconnected folded network of tubular structure in the of the cytoplasm. Now we see the structure of endoplasmic reticulum. It is called rough endoplasmic reticulum and smooth endoplasmic reticulum due to presence of some these structure, fine presence of structure, granular structures. Okay. Endoplasmic reticulum and Golgi apparatus are involved in the formation of cell organelles such as lysosomes and peroxisomes. You know lysosomes? What is another name of lysosome? Why it is called suicidal phase of the cells? Because it contains very good hydrolytic enzymes. Hydrolytic enzyme. Achha, what is the meaning of hydrolysis? What is the meaning of hydrolysis? Who can give the answer? Yes. What is the meaning of glycolysis? Sit down. Simply, there is a breakdown of the substance in presence of water. It is called hydrolysis. and if they have breakdown of the substance and this substance is carbohydrate, it is called glycolysis. This is some basic difference. Okay, and these hydrolytic enzymes contain peroxisome. Basically, peroxisome, if you know the function of peroxisomes, it contain antioxidants. If many students ask, sir, what is antioxidants? Antioxidants are the substance which can engulf the free radicals in the body, the reactive oxygen species, reactive nitrogen species, and these enzymes are catalase, first one, glutathione, reducing glutathione, it is tripeptide, peroxisomes. So all these are enzymes mainly secreted by these sub-organelles. Okay. Now the function of the endoplasmic reticulum, it is helpful for the synthesis of proteins. How the proteins are synthesized? By the central dogma process. Central dogma process is what? Replication, translation, transcription, post-translation modifications. All these are what? Central dogma process. So very important. All the molecular concept, molecular biology is important. Function are proceed in two main organelles, endoplasmic reticulum and ribosomes. The endoplasmic reticulum also the mechanism for maintaining the quality of the protein synthesized. The endoplasmic reticulum has three different sensor molecules that monitor the amount of improperly folded protein that accumulate. Basically, these we talk about the post-translational modification. Post-translational modification. If there is some proteins which are not appropriate for the body to synthesize in translation, so by this endoplasmic reticulum, it is maybe modified, and we call this modification as post-translational modifications. So these organelles will participate in PTM process, post-translation modification process. Okay. Different types of these tumor markers, some drug cytochrome P40 that catalyzes hydrolysis reactions. When we studied about the xenobiotics, we understand that cytochrome P40 mainly hydrolysis process by these endoplasmic reticulum. These enzymes are important in biosynthesis of steroid hormone for removal of toxic substances. So all these are the functions. Now Golgi apparatus, okay. You know the function of this. These are basically helpful for the transcription process, for initiation, elongation process, because all the genetic code you know, triplet codon which contain different amino acids. Okay, all the genetic code are mainly attached with specific code in ribosomes. So ribosomes is very important. For the proteins are processed, modified and prepared to export the cells. It is very helpful for synthesizing of the cells. Okay, if the question is asked, write about Golgi bodies. It is for protein sorting, protein synthesizing, and after the modification of central dogma process. Helpful in these processes. It work in association with endoplasmic reticulum where proteins for certain destination are synthesized. That means which type of proteins are synthesized, because you know our body wants regular proteins for growth, for function of the body. If you see the function of proteins, there are several functions. Catalytic function, transportation functions, immunology, all these are what? All these are proteins. Okay? So, these subcellular organelles important for synthesizing of proteins. And we especially talk about the hormones. Golgi apparatus with endoplasmic reticulum. Okay? So it is mainly 60S, 40S different subunits which can participate in different processes, transcription, translation and other processes. Okay? Now the function of Golgi apparatus, proteins which are synthesized in endoplasmic reticulum pass through the layer of Golgi apparatus where enzymes is Golgi membrane catalyzes the transfer of carbohydrate units to protein to form glycoproteins and lipid to make glycolipids. And process that is important in determining the protein eventual destination. That is the meaning is that how the Golgi apparatus helpful for the formation of cell membrane. Because in the cell membrane there is biomolecules are present in the form of glycoproteins. That is glycoproteins and glycolipids. Understand? In the cell membrane is a composition of carbon, hydrogen, oxygen and nitrogen. These substances. Okay? And another way, there is a presence of carbohydrate in different combination forms. Like glycoproteins. Glycoproteins is what? It is conjugated proteins. Like apoproteins. Okay? So carbohydrate attached with the protein molecule and it forms glycoproteins, glycolipids. All these are formed by these Golgi bodies. The modified proteins are sorted, packaged and transported. We call this, all these are central dogma process. Okay? And we call these important terms post office mail sorting rooms. Post office mail sorting rooms. You understand the term? In the smooth endoplasmic reticulum, there is a formation of different proteins. Which one is right, which one is wrong for the body? It is all are processed by Golgi apparatus. And we call this term in molecular biology called post-translational modification. Understand? When we discuss all these topics about central dogma, transcription and translation, we discuss in detail. Okay. Now mitochondria. Who can discover mitochondria? Who discovered mitochondria? Because I don't know. I think you know. Acha, who can discover ATP? I know. Scientist Lipman. Lipman can discover ATP. Okay. So it is called powerhouse, power plant of the cell due to the generation of the ATP, you already know. And there is exceptional that erythrocytes having lack of mitochondria. Having lack of mitochondria. And these are exceptions, they derive their ATP from glycolysis due to lack of mitochondria. Students, basically the site of the glycolysis is cytoplasm. It is not mitochondria. Understand? So all these enzymes which can participate in the glycolysis cycle are present in the cytoplasm. So in erythrocytes, the glycolysis proceeds and they can provide the ATP for different functions, but not other cells. So all the other cells like hepatocytes, nerve cells, okay, all these cells take the ATP from the mitochondria by electron transport chains process. Different complexes are present. Each mitochondria is bound by two membranes. It is important. It is double membrane structure which can fold it inside the organelle and we call that crusty. Now we see the structure. Outer membrane, crusty, inner fold of this membrane, intermembrane space, inner membrane space and matrix, and in this crusty there is a presence of microsomes. Fine particles are present, microsomes, and these microsomes contain different marker enzymes. Why we call marker enzymes? Because they can operate a particular metabolic pathways. The relative pore smooth outer membrane is permeable to most molecules. The inner membrane, which is impermeable to ions and different organic molecules, the inner membrane projects inwards, and this fold is to be called cristae. Function of the mitochondria, that is very important. Intermembrane space contains several enzymes involved in nucleotide metabolism. They are the biomolecules, carbohydrate, proteins, lipids, nucleotide, nucleic acid, DNA, RNA, adenine, guanine. All these molecules are considered in nucleotides and nucleosides. Okay? Gel-like matrix consists high concentration of enzyme required for metabolic pathway of oxidation of pyruvate. Oxidation of pyruvate. My question is, how these pyruvates are come? Very good. By glycolysis cycle. By glycolysis cycle, there is oxidation of pyruvate, means production of the ATP is proceed by electron transport chains. All these are proceed in which organelle? Mitochondria. Okay. The mitochondrial matrix is the site of most reactions. Citric acid cycle, fatty acid oxidation, we called as beta oxidation of fatty acids. So all these are proceed in mitochondria. Why? Because all the important marker enzymes are present in this mitochondria. What happens if there is absence of this mitochondria? The first one is the cell. The first one is the RBC, which have absent of mitochondria. But if there is mitochondria are not functioning well, there is a disease we call as mitochondrial myopathies are occur. Mitochondrial myopathies. The example of these mitochondrial myopathies are Parkinson's disease. Okay. Component of lactose transport systems. ATP are embedded in this inner membrane for protein synthesis. Mitochondria contain their own DNA, which all these which can code other codons and different functions. In recent year, mitochondria have been recognized as the key regulatory of apoptosis. Apoptosis is basically natural death of cells, and we called as programmed death of cells. It is not a type of necrosis. It is not a death by a chemical substances or other physical agents. Understand? If there is programmed death of cells, machinery regulation, a proper death of cell we call as apoptosis. So in the recent year, the research is going on, and we find out that mitochondria play a vital roles in this apoptosis process. Okay. So mitochondria have a key role in aging because it is the initiator of apoptosis. Now lysosomes. Lysosomes we all are contain hydrolytic enzymes. These hydrolytic enzymes are proteases, nucleases, glycosidases, lipases, phosphatases and sulfatases. What is the meaning of proteases? These enzymes can break down the proteins molecules. Proteins molecules. Okay? In tripeptide, proteins molecule. You don't understand that it can break down a quaternary structure into a primary structure. It is not proteases enzyme. Proteases enzyme is what? It can break down the large molecule into simple one. It can break down the polypeptide into tripeptide or dipeptide molecules. Okay? Glycosidases, breakdown of glycosides basically. So all these enzymes, acidic pH, so pH of lysosome matrix maintain about 5. So it is acidic or basic? 5 is acidic or basic? Acidic. Which one is basic? More than 7. What is the pH of the blood? What is the physiological pH? Physiological pH, if somebody says what is physiological pH, you understand, they ask about the blood pH. Okay. So physiological pH is what? 7.4. Now the functions. What is the function of lysosomes? Digestion of intra and extracellular substances. Lysosome form endocytosis. There is a process of engulfing foreign molecules. It is called phagocytosis, exocytosis and endocytosis. Okay. During development, lysosome play an important role in the formation of specialized tissues. Lysosome digest the babe tissues, joint, finger and toes in the embryo. So it is not important. Now peroxisomes. Peroxisomes. Peroxisome is the important cell organelle because it contains all the important enzymes which can detoxify, catalase, uric acid oxidase and D-amino acid oxidase. And due to this, there are some involved errors are occur. What happens if the enzymes are not present from the bond? If the enzyme is not present during birth, these substances are suffer from a disease we call the disease inborn errors. We call this inborn disease. Okay? If there is uric acid oxidase enzymes are absent, if there is D-amino acid or oxidase absent, the person is suffer from a disease called gout. Okay? Gout, there is deposition of the uric acid in the soft tissues. And D-amino acid is oxidase is absent and the person is suffer from a disease called Hartnup disease. Okay? So all these are important. So if somebody is asking what is the function of peroxisome, it is mainly helpful for the detoxification process. Why it is important? Because it contains all the antioxidant enzymes. And what is the function of antioxidant? It can reduces the activity of free radicals like reactive oxygen species, reactive nitrogen species. Detoxification process and peroxisome also participate in degradation of very long chain fatty acid synthesis, glycerolipids, plasmalogens and isoprenoids. So these are the molecules, we studied these molecules, glycerolipids, plasmalogens, isoprenoids. It contains nitrogen contained lipids and all this we discuss in the classifications of the lipid. Okay. So there is very long chain fatty acid means fatty acid can divide on the basis of number of carbon molecules. Long chain fatty acid, very long chain fatty acid, short chain fatty acid, SCFA, VL, CFA, very long chain fatty acid, short chain fatty acid. So during the metabolism, it is not easy to digest very long chain fatty acid. It is easy डाइजेस्ट करना इजी है क्या लॉन्ग चेन फैटी एसिड को? तो क्या करना पड़ेगा? इसको ब्रेक डाउन करना पड़ेगा. एंड फॉर दिस ब्रेक डाउन व्हिच ऑर्गेनल इज हेल्पफुल? Peroxisomes. Okay? In peroxisome, the number of molecules which are not metabolized and oxidized by the enzyme by using molecular oxygen directly and produce hydrogen peroxide. Hydrogen peroxide is very harmful molecule for the body because it causes lipid peroxidation process. Lipid peroxidation process. Break down the lipid peroxidation and it is not good. So during different disorders, different diseases like diabetes, mellitus and others, there is peroxisomes activity is more and they can increase this hydrogen peroxide activities and there is lipid peroxidation process is more. Okay. Hydrogen peroxide is destroyed further by catalase and peroxidase. And we call this as reactive oxygen species. What we called? Reactive oxygen species. So ultimately what I say, that peroxisomes can decrease the activity of reactive oxygen species by antioxidant activity. Which can play antioxidant activity? These enzymes, catalase and peroxidase. Okay? Now nucleus. Nucleus is very important. Why it is important? Because all these nucleus contains all the genetic information of the cells inside the nucleus. So there is a presence of histone proteins because DNA is overlap over the histone proteins. There is compactization of DNA is present. Okay? So DNA is a control center of the cells. It contains the DNA organized into chromosomes which carry genetic information. How many chromosomes we have? How many? 46. How the chromosomes are formed? What it contains? It contains DNA, it contains histone proteins, it forms nucleosomes, and finally it forms chromosomes. So on the basis of chromosome is very important to understand the genetic pattern of individuals. If there is no nucleus, there is no genetic chromosomes are formed. Okay? The nucleus is surrounded by a double membrane called nuclear envelope. The outer membrane is fused to endoplasmic reticulum with multiple sites, nuclear pore. So these are the structure you understand. There is a double membrane structure. It is outer membrane, inner membrane, and these outer membrane contain these structures. And this is called endoplasmic reticulum. What is the function of endoplasmic reticulum? What is the function of endoplasmic reticulum? From the last one, second row, who are sitting, last one, corner, आपके आगे, हाँ, what is the function of endoplasmic reticulum? Transport of proteins. Who can transport? Huh? So what is the function of ribosomes? What is the function of polybodies? You are not in my class. You are not in my class. Sit down. It can functions for protein synthesis combined with Golgi bodies. First one. And the main important function is that it can helpful for the formation of glycoproteins and glycolipids, which is helpful for formation of membrane. Okay. So it contains chromatins, nuclear pore, perinuclear shapes. These are the simple structure of general structure of nucleus. It contains all the genetic informations that contain DNA which around with histone proteins. Okay, and these histone protein can forms chromosomes, compactizations. Now the functions. DNA, the repository of genetic information located in the nucleus. If somebody is asking what is the function of nucleus, so you just say simply, it is a repository of genetic information. First thing. Second one, the nucleus contains proteins and enzymes for the replication of DNA, repair of DNA that has been damaged. Means again, nucleus play important molecular functions. That is replication of DNA, repair of DNA occur because it contains again marker enzymes which are helpful for replications and repair of DNA. Can anybody tell a single name of enzymes which is in DNA? Replication? Endonuclease, exonuclease, restriction endonuclease. What they do? They can do a particular functions. They can separate the DNA molecules and on the basis of that, new primers are attached for the formation of proteins. So all these important functions are proceed in which? In the nucleus. And it is helpful for the DNA repair. There is several types of DNA misconcept like mismatched pair of DNA. Okay. So all these are proceed in the nucleus. The major function role is replication, synthesis of new DNA, transcription, formation of RNA from DNA. Okay. Ribosomal RNA, transcription RNA, mitochondrial RNA. The process, messenger RNA. The process of RNA assembly of ribosomes require protein synthesis in cytosol occur in the nucleolus. So these are all the functions that is important and give in the tabular forms. It is also given in your book. You can take a reading of all this important. Cytoskeleton, presence of some microfibril which is helpful for maintaining the structure of the cells. Okay. Function of cytoskeleton is what? It can maintain all the cell frame, exoskeleton of the cells, proper structure of the cells, okay, location of different cell organelles, responsible for separation of chromosome during cell divisions. All of you go study, take the study, microfilament. Okay, students, so we will discuss. I think this topic is over. This topic is over. And what is cell fraction? Cell fraction is what? It is a homogenization process through which different subcellular organisms can separate out on the basis of their density. वेट के हिसाब से वो सेपरेट कर देते हैं, उसमें हम एंजाइम्स की स्टडी करते हैं, उसको कहते हैं सेल फ्रैक्शंस. ओके, ये आपकी बुक में दिया हुआ है, आप एक रीडिंग लगा लेना इसका और सब हो जाएगा. ये एंजाइम्स का ये पढ़ लेना इंपॉर्टेंट है. These are the importance which organ contains which enzymes. Okay, and here your cell and subcellular organ is over. Thank you.
পড়াচ্ছিলাম তোদের একজন বল, একজন বল কে না কেউ ক্লাস ক্লাস এই যে ফার্স্ট ক্লাসে আসছিস কি পড়াচ্ছিলাম আরবিসি. ওকে, so in previous class I discussed about what are the factors regulating the RBC, right? Main regulation is hypoxia. In short, I am dealing with it in short in the previous class. So in hypoxia, there is an important stimulus. Hypoxia can hoti jabe if any types of blood loss, a patient or any person is going to a high altitude, that may be due to some hypoxia. So whatever it may be, bone marrow stimulation will be mostly stimulated by the hypoxia. And for this hypoxia will come in action in erythropoietin by the help of transcription factor. কি নাম বলেছিলাম? HIF. That means hypoxia inducible factor 1 alpha and 1 beta. Right? If those two are combined, then only erythropoietin will be synthesized. Because then only they can enter into the nucleus. And then it attaches to a hormone responsive element. এই নামগুলো তোরা এখন জাস্ট টাচ করে যা, বায়োকেমিস্ট্রি সব হবে এগুলো. Because in case of transcription, this element of this DNA is very important. In this way, transcription, translation, mRNA, and in this way, some protein, like in this case, erythropoietin will be released. Erythropoietin is a stimulus that formation helps from the pro-erythroblast. Stage গুলো মনে আছে? Erythropoiesis stage, পর that is কি বলেছিলাম? Committed stem cell, right? Committed stem cell, myeloid series, lymphoid series. In case of myeloid series, it's for the formation of RBC, WBC, platelet. Lymphoid series for the lymphocytes. So in case of myeloid series, is myeloid, first of all, first thing will be colony forming unit E. That means erythroid series will be driven. ওই দিকে যাবে, ও তৈরি করতে যাবে, that will form towards the RBC formations, right? Then pro-erythroblast, then 3 erythroblasts will be formed like that. That is a basophilic, very good. Polychromatic, very good. Orthochromatic, very good. Reticulocyte and the mature. Reticulocyte will stay in the bone marrow 2 to 3 days. After that is come into the circulations. Then another 1 day for the formation of the mature RBC. And in the RBC, the presence of hemoglobin. In one RBC, কতগুলো hemoglobin থাকে? How many? Yes, 280 million. Huge amount. So this huge amount is important for the carrying oxygen in iron. Iron is present in heme. Hemoglobin means heme and globin protein. Heme মধ্যে protoporphyrin ring and heme and iron is there. Protoporphyrin ring, iron is there in case of heme. And globin is a part that is a 2 alpha and 2 beta, normal. Hemoglobin chapter will be discussed by Dr. Akash. It is not completed at all now. It is a first class taken. So probably the next class will be taken in the coming Wednesday. Okay, he will try to finish because hemoglobin is a big chapter. If there is unfinished, then I will complete that. Now, up to this, any confusion? What is RBC? Because RBC is requirement for any patients coming with some pallor, respiratory distress, fatigue. Why it is happening? Why it is happening? Because of oxygen নেই. Because oxygen carrying capacity will be decreased if the RBC level is small. Okay? The RBC level কমে যায়, then আমাদের oxygen carrying capacity কমে যাবে. Because RBC এর মধ্যে hemoglobin. Hemoglobin এর মধ্যে iron. Iron carries the oxygen and globin part carries the carbon dioxide. Remember, we will deal in these positions only the O2 and CO2. That is the carbon dioxide and oxygen. So RBC is very important in our day-to-day life. আমরা যে নিঃশ্বাস নিচ্ছি সব কিন্তু আমাদের RBC level is now fixed. That is normal level of RBC. Male female is different. কে বলবি? Normal level কত? মেলের ক্ষেত্রে 4.5 to 5 মিলিয়ন পার কিউবিক মিলিমিটার বলতে পারিস, অনেক ভাবে এগুলো বলা যায় ইউনিট, বাট these are the millions, right? In case of female, it is a 4 millions, 4.5 to 5 in male and 4 millions in case of female. Why female is less? Because the other hormones other than erythropoietin that was discussed, that is the thyroxine and the testosterone or androgens, specifically androgens. And these androgens are helpful to stimulate the thyroxine, and thyroxine stimulate the erythropoietin. And erythropoietin stimulates the whole process of erythropoiesis. That is the stage of pro-erythroblast, to basophilic erythroblast, polychromatic erythroblast, orthochromatic erythroblast, and reticulocyte and RBC. So in this way, now what is the importance of this RBC? Because you will came across with some patient who is coming with pallor, fatigue, respiratory problem, etc. Now suppose the patient along with 32-year male patients coming with pallor, shortness of breathing. SOB means shortness of breathing. That is শ্বাসকষ্ট হচ্ছে. Is he or she is male patients is coming with some sorts of respiratory distress, we clinically detect that the patient is suffering from pallor. So respiratory distress, some fatigue is there, and also some history of some blood transfusion 2 months back. Blood transfusion in 2 months back. Transfusion 2 months back. That means we are dealing a patient, there is a blood physiological problem. So when we are dealing any patient sorts of like symptoms, we always do a simple test. What is that? Yes? Complete blood count. Complete blood count. This is very much important because in complete blood count, কি থাকে এখানে? Hemoglobin, total count of WBC, total count of RBC, PCV, back cell volume, MCV, এইগুলো একটু আজকে লিখব. তাহলে in case of complete count, থাকে আমার hemoglobin, থাকে আমার total count of RBC, total count of WBC, আচ্ছা আমার differential count, TC means neutrophil কত, basophil কত, eosinophil কত, lymphocytes কত. These are the coming in TTC, differential count. And also in RBC indices, it is called RBC indices. In this part, there are four things mainly. One is PCV. PCV means packed cell volume. What do you mean by packed cell volume? If we collect a blood from this guy in a test tube and centrifuge the blood. Suppose এটা একটা টেস্ট টিউব আছে, ঠিক আছে, আমি সাপোজ এখানে সাপোজ আমি 100 ml এর একটা ব্লাড নিয়ে নিলাম, 100 ml এর blood, and then centrifuge this. After centrifugation, the blood cells and the plasma will be separated. Separate হলো, এখানে প্লাজমা আর এখানে হলো RBC. But in the meantime, this will be a buffy coat. This is called buffy coat. Presence of WBC and RBC. WBC and RBC, buffy coat, it will come after the centrifugation. Centrifugation মানে centrifugationের যন্ত্র আছে, এখানে আছে, সেটাকে ব্লাড স্যাম্পল নেওয়া হলো, blood, and then it goes to the centrifugation machines, and then it will come after the centrifugations. That is a 45% of RBC, 45% of RBC, and around 55% of plasma, and less than 1% of buffy coat. Less than 1% is buffy coat. Buffy coat presence of WBC and platelet. Now, what is packed cell volume? Packed cell means cellular component. That means this part, RBC and both these buffy coat normally. But as the buffy coat is a negligible amount of cell is there, so always we calculate the packed cell volume in respect of only the RBC. So packed cell volume means another term is that hematocrit. Hematocrit. এটা আরেকটা নাম হচ্ছে hematocrit. So this hematocrit is important for any patients coming of sorts of dizziness, of respiratory problem, fatigue, etc. Also very important in case of dengue. যখন ডেঙ্গু হয়, then always we prescribe যে ভাই তোমরা একটা PCV-টা every alternate day করো. Because in that case, PCV যদি আমার বেশি কমের ব্যাপার হয়, that means প্লাজমারও বেশি কম হবে. If there is a leakage in case of dengue hemorrhagic shock, you will come across that there is a problem is that only the leakage. Leakage means what? It is a blood leakage in case of microcirculation. It has come to the third space, and then this is a dangerous of dengue shock syndrome because আমার হার্ট পাম্প করতে পারছে না because of leakage. লিকেজ হচ্ছে বেরিয়ে যাচ্ছে আমার সমস্ত যার জল সেটা থার্ড স্পেসে চলে যাচ্ছে ব্লাড ভেসেলস থেকে. যদি সেইটা হয় তাহলে আমার যদি এইটা বেরিয়ে যেতে থাকে তাহলে এর কনসেন্ট্রেশনটা কি হবে? আলটিমেটলি ইনক্রিজ করতে থাকবে. দ্যাট ইজ দ্য ডেঞ্জারাস ফর এ ডেঙ্গু পেশেন্টস. তো আমি কোথায় জানতে পারবো? হিমাটোক্রিট জানতে পারবো. নর্মাল ভ্যালু কত? 40 to 45%. Normal value is PCV 40 to 45%. Again, there is a difference in case of male and female. In case of male, that is a 42 to 45 normally, and 38 to 40. At least we always try to restrict our PCV within the 38 percentage. This is the percentage. This is the percentage. Nothing else. Kono gram tham kichu nei. Hematocrit value is a RBC indices, one of the important part to detect the patient's conditions of this volume. The volume status ki ache. Indirectly, it indicates that the PCV value is of the RBC only. But it's not only. Jodi fiberte jigesh kora hoy, it is only for RBC. No, sir. It is definitely packed cell volume. That means after the centrifugation, the cellular part, the percentage of cellular part is deposited. That is the part of packed cell volume. But as the buffy coat is less than 1% of cell, we consider that negligible amount of cell, and that's why we consider PCV means only the RBC count or RBC mass. RBC mass is very important, and so PCV is normally the hematocrit. It helps to detect our body fluid volume and body fluid status. Now, another is MCV. MCV means mean corpuscular volume, right? Mean corpuscular volume. That means the volume of one RBC cell. Volume of one RBC cell. MCV means mean corpuscular volume. That means the volume of one RBC cell. এত সেলের মধ্যে আমি একটা সেলকে এমসিভি করব, তার ভ্যালু কত? নরমালি কি করে পাবো? ফর্মুলা আছে। সেই ফর্মুলাটা কি জিনিস? সেটা হচ্ছে পিসিভি বা আরটা কি নাম বললাম? হিমাটোক্রিট বাই টোটাল কাউন্ট অফ আরবিসি। টোটাল কাউন্ট অফ আরবিসি into 10. It will come basically 90 femtoliter. লিটার আছে, ml লিটার আছে, বাট এতটাই লিটারটা এতটাই কম, ml এর থেকেও মানে ml লিটার ডেসিলিটার সব পেরিয়ে টেরিয়ে তার একটা এতটাই ভলিউমটা কম। বুঝতেই পারছিস একটা আরবিসি ভলিউম তো খুব ছোটই হবে। কিভাবে এলো এটা? Suppose this PCB is 45 and the RBC count is 5 million ধরলে, তাহলে 5 কত হলো? 90 ফেমটোলিটারটা আসছে, সব বইয়ে দেওয়া আছে। So these are the volume of single RBC. It is the volume of single RBC. Now why it is important? Because it is important for the classification of anemia. Now what is anemia? বুঝতে পারছিস মেডিকেল সায়েন্সের একটা টার্ম শেষ হবে তো আরেকটা টার্ম স্টার্ট হবে। তোরাও যখন পড়াশোনা করবি, when you are going to go through the study, always touch the tail and then from tail to head to another tail and another tail, link up, all are the linked up যত ভালো হবে as a clinician তত ভালো হবে। Okay, so these are the MCV, that is a femtoliter, important for the classification of anemia. What is anemia? Anemia means, বলো, anemia means, আচ্ছা আমি আগে ওয়ার্ডটা লিখি। anemia, N means without, Nia means blood, means without blood. Simple thing. So if there is a patient suffering from some reduction of RBC or oxygen carrying capacity is less or hematocrit value is less or hemoglobin concentration is less or low, then we term as a anemia. Anemia ক্ষেত্রে কি বললাম? Anemia only detected when the oxygen carrying capacity of RBC is less and it depends on the age, sex and environment. Because suppose a patient in Gangtok, তার যা হিমোগ্লোবিনের পার্সেন্টেজ হবে, তার যা অক্সিজেন ক্যারিং ক্যাপাসিটি হবে, সেটা তো আমার তো হবে না। We are in plains. That's why it depends to some extent on the age, sex and also the environment. So anemia means reduction of RBC count, reduction of hemoglobin, reduction of PCV. তিনটে ডেফিনেশন ভাবে বলতে পারলে খুব ভালো, কারণ এই তিনটেই কমবে। নাও এমসিবির পরে আছে এমসিএইচ। এটা কি জিনিস? মিন কর্পাসুলার হিমোগ্লোবিন। আরেকটা আছে এমসিএইচসি। এইটা আমি তোদেরকে বলেছিলাম, মনে আছে? কিসে বলেছিলাম বলতো? ভেরি গুড, হেরিটেজ স্পেসিস। এই হসপিটাল থেকে। So these are the indices you came across through your book, but I would like to suggest that it should be done in a good So PCV, MCV, MCH, MCHC, these are the RBC indices. Short note আসতে পারে। Now, what is the difference between the mean corpuscular hemoglobin and mean corpuscular hemoglobin concentration? এটা তো খুব একই রকম জিনিস। ডিফারেন্সটা একটাই, সেটা হচ্ছে in case of MCH, that is the formula is that RBC mass by RBC count into 10. RBC mass and divided by RBC count into 10. That is MCH. That means mean corpuscular hemoglobin. Again I am repeating. Mean corpuscular hemoglobin. Now what is the meaning of MCHC? So MCHC, what is that? Mean corpuscular hemoglobin concentration. কি জিনিস? That is equal to RBC mass, sorry, এটা hemoglobin mass, it is hemoglobin mass and RBC volume. That is the difference into that is present in 100 percentage. So কি হলো? MCH means average concentration, average amount of hemoglobin in a per RBC cell. একটা RBC সেলে হিমোগ্লোবিন কতগুলো আছে? আর mean hemoglobin means concentration means per unit volume of RBC তে কতগুলো হিমোগ্লোবিন আছে। বোঝা যাচ্ছে? এখানে দেখ, এখানে কাউন্ট হয়ে গেছে আর এখানে ভলিউম হয়ে গেছে। দ্যাট ইজ দ্য ডিফারেন্স। সো দিস নরমাল ভ্যালু ইজ কত হবে? মোটামুটি দেখ, মনে রাখার দরকার, দেখ হিমোগ্লোবিন মোটামুটি 15 ধরি আমরা। হিমোগ্লোবিন লেভেল অফ মেল ফিমেল ডিফারেন্স বুকে ডিফারেন্স গিভেন, আমি তর্কের মধ্যে আমি যাবই না। মেলে অ্যাভারেজ তুই ধরে নে 14 to 16, মেলের ক্ষেত্রে 13 to 17। ওকে, দেন আমি একটা অ্যাভারেজ নিলাম 15 হিমোগ্লোবিন। আরবিসি কাউন্ট আগে বলেছি 5, কাউন্ট আছে এখানে, কাউন্ট আছে। দেন 100, তাহলে কত হলো? 30 কি পিকোগ্রাম, 30 picogram. That is equal to 30 picogram. That picogram, femtoliter, the difference units is different because these are very small amount. So MCH, mean corpuscular hemoglobin, is the amount of hemoglobin present per unit RBC. MCHC, amount of hemoglobin present per unit volume of RBC. বোঝা যাচ্ছে? And this calculation will come as a 33%. And if any patient is above 33%, that's coming in 40%, 43%, always suspect hereditary spherocytosis. This is the only case where MCHC will be increased. And remember, MCHC for the nomenclature for the normochromic. আমাদের যখন অ্যানিমিয়া আসবো তখন দুটো টার্ম আসবে, একটা হচ্ছে নর্মোসাইটিক, নর্মোক্রমিক, মানে সেলের ভলিউম আর সেলের কালার। বুঝতে পারছিস? যখন নর্মোসাইটিক মানে সেলটা নর্মাল সাইজ, অ্যান্ড নর্মোক্রমিক সেলের নর্মাল কালার। কালার সেলের কিভাবে আসে? হিমোগ্লোবিনের জন্য আসে। সেটা কি জিনিস? এইটা। সো these are for the color of RBC cell. And these are the size of the cell. Size of the cell. Cell means RBC. এইটা ভুললে চলবে না। Any you are interpreting any, মনে কর তো বাড়িতেই কারো একটা সিবিসি রিপোর্ট তুই হামেশাই পাবে। So that will detect, দেখা অভ্যাস করা মানে এখন থেকে সিবিসি রিপোর্টটা কিরকম হয় দেখবি ঠিক এইভাবে আছে। হিমোগ্লোবিন, টোটাল কাউন্ট অফ RBC, total count of WBC, differential count, then RBC indices will come. Platelet count, everything will be there. CBC means complete blood count. So these are the RBC indices, and MHCAC for the color, that is chromic. Chrome means color. And this is cytic, means cell size. So when we are dealing with any classification of anemia is very important to detect the cause of that anemia. একটা পেশেন্ট আসছে প্যালো, শর্টনেস অফ ব্রিদিং, ফ্যাটিক, ব্লাড ট্রান্সফিউশন করেছি, তার তো অনেক কজ হতে পারে। আমি কজগুলো ভাববো কিভাবে, how can I approach these patients? আমি কি তাহলে when I will do the investigation of some lakhs and thousands, 50,000 একটা ইনভেস্টিগেশন করে আসো। So we are not to be a clinician. So when you are going to be a clinician, then the perfect indication test must be there. Don't behave like a quack. You are going to be a qualified doctor. Not at all that this you are coming in the private medical college. Oh, private medical college. So this image must be removed by your own. Right? Private medical college পড়ছিস বলে অনেকে অনেক হেল্প করবে। But that is not the situation in our Shantiniketan Medical College. Believe me, your faculty at this point is top class. I am not telling about me. But all the faculties are very, very good and very, very sincerely they are trying to teach you their experiences. I am being a clinician. I am practicing for like 15 years for a child. I am dealing with child always. আমি আজকেও যখন এসেছি তখন 6টা পেশেন্ট দেখে এসেছি। So always we deal with our patients and that is my experience and that experience is reflecting in this board. So you have to gain some of my knowledge. It will be beneficial for every day-to-day work. You can ask your seniors also and they are dealing now the patients because I am not dealing like the booklet. আমার কোনো কিন্তু skin share নেই. We only speak in chalk and talk. In my brain is there. Okay? And that is the ideal and crucial for you to learn. Not to the, আমি এক্সামে লিখবো এটা ভালো নাম্বার পাবো। No. Anything you are coming in erythropoiesis and RBC in your question paper, if you learn to some extent from my class, you will be passed. And honors level. Because the terms are using the day-to-day life, what is important to dealing with any patients with anemia. Before going to the anemia, you have to know the some RBC indices. So, this is color and this is size of RBC. MCV, yes. No matter, pallor is there. Pallor means what? Pallor means what? Pallor means সাদা হয়ে গেছে, ফ্যাকাসে লাগে। I will do for any pallor patient, shortness of breathing, fatigue patients will do CBC or this. Now I have to detect, I am coming later. I have to detect what is the cause of this anemia, of what is the cause of shortness of breathing, what is the cause of pallor. I have to detect. That is the clinician. We are going to be a clinician and a good clinician. Not at all the private medical college to likhe. No, not at all. So RBC indices, PCV, pixel volume, MCV, that means size, MCH, not so much important in clinically, MCH is clinically important for the color, right? And that is only increase, only disease increase in MCHC, that is the hereditary spherocytosis. Already you know the RBC membrane proteins, right? Spectin, ankyrin, আমি আগের দিন বলেছি। এবং একটা গল্প তো থেকে বলেছিলাম, ব্রাইডাল ড্রেস, ওকে? So a patient coming, a bridal dress, a groom is coming and going to tunnels like that and it will broken down. If that so happen and then ultimately she will cover up all the traces and the globular structure will happen from the biconjugate disc of the RBC. So the shape of the RBC is maintained by the cytoskeletal structure of the protein. It is discussed previously. And so if there is a genetic problem, there is a genetic problem of spectin or ankyrin, there is no site or there is no shape maintained of RBC. কি হয়ে যাবে? গ্লোবুলার হয়ে যাবে, spherical হয়ে যাবে। And this, if it is spherical, then the microcirculation of our endothelial system, that is clean, and there is a macrophage will engulf, খেয়ে নেবে। তাহলে কি হবে? প্যালর হবে, আমার hemolysis হবে। I'm coming later in the classification. So up to this you have to remember there is some, কি হয়েছে বেটা? Any problem? Yes? Please, your shoes is outside the paint. Okay, thank you. So this time, this is the RBC is very important for your clinical aspect and also classification of the anemia. Because classification of anemia is by two ways. One is etiological. I am coming now. One is etiological. What do you mean by etiological? And one is morphological. One is morphological. Etiological means, etiology means cause. Etiology means cause. কি কারণে হচ্ছে? And another is morphology. What do you mean by morphological? Structure, right? Very good. In case of morphology, we will depend on the two things already discussed. One is color, that is MCAC, and another is the size. That is no. MCAC is color and size. MC? No. MCV, MCH এর কোনো ক্লিনিক্যাল ইম্পর্টেন্স সেরকম নেই। একটু আগেই বললাম। এই জন্য তোদের হচ্ছে ভুল, তাই তো? রাইট। MCV, sorry for that. MCV means volume of one RBC. Volume of one RBC. Volume of one RBC means volume তো থাকবে। Mean corpuscular volume is for the size, not MCH. Sorry for that. MCV means size of volume of one RBC, and that is important for the size. That may be big, that may be small, may be normal. Normochromic, MCHC, that may be normal, may be hypo. কে কথা বলছিস? But almost never happens hyperchromic. Hyperchromic only seen in case of hereditary spherocytosis. Okay? Now, classifications of anemia. What do you mean by classifications? জানতে হবে এটা। কেন জানতে হবে? To reach a diagnosis. To reach your diagnosis. কি করে যাব? So, classification of anemia. Two parts is there. One is কি বললাম? Etiological. Another is yes, morphological. Morphological. দেখি যদি টাইম পাই সবটা বলবো। Morphology means always remember we will deal with MCV and MCAC. Finish. MCV and MCAC. Only for the morphological classification. But in case of etiological classification, you will tell RBC formation will be hampered to cause a anemia. কি করে হবে? কিভাবে আমি etiology cause গুলো ভাবতে পারবো? How? You will tell. বল, ভুল বল না, কি আছে? Low iron, very good. তার মানে that is the term as deficiency anemia. Sit down. So in case of etiology, number one, deficiency anemia. ও যা বললো সেটা দিয়ে স্টার্ট করব। deficiency anemia কি হতে পারে? ও বলেছে একটা আয়রন, আর কি হতে পারে? হ্যাঁ, yes, folic acid. And then yes, very good. So deficiency of the brain. কেন? Now these are the important for the bone marrow, for the formation of this. Vitamin B12 and folate is essential for the condensation of DNA. Synthesis is there. If that is not present, the size of the cell will be big. I am coming later. But etiological. Then again number two etiological. Number two. বল, যা বলবি ওখান থেকে স্টার্ট হবে। কি বলবি? হেমারেজ। হ্যাঁ বলো, তুই কি বলছিস বল, বসে বল। হ্যাঁ, হয়। Oxygen is needed for the formation of RBC. Is a stimulus, but not the factory তে যায় না। আমার বোন ম্যারোতে অক্সিজেন is not essential to reach the oxygen in the bone marrow. Then only RBC will form. No. Oxygen is only for the stimulatory effect of the hypoxia inducible factor to synthesis the erythropoietin, sit down, to release the stimulation of the process of erythropoiesis. Enough. Okay? Now, এটাকে ঘুরিয়ে বলি blood loss. That means hemorrhagic anemia. Hemorrhage মানে রক্ত বেরোচ্ছে, hemorrhagic anemia. Anemia. Okay? Hemorrhagic anemia. Conditions কি হতে পারে? Now you are going to be a clinician. Suppose a patient come with acute blood loss. কি ক্ষেত্রে হতে পারে? Acute means কিছুক্ষণ আগে হয়েছে, এক দুদিন আগে হয়েছে, and another is a chronic, that means some weeks, some months, some years. So that is called acute, means suddenly হয়েছে, হয়তো পারে 1 ঘন্টা আগে হয়েছে, হতে পারে 1 দিন 2 দিন 3 দিন 5 দিন বা 7 দিনের মধ্যে হয়েছে, that is called acute. To some extent some diseases are there, acute condition means 2 to 3 weeks, 3 to 6 weeks also there. I am not details in that acute case, but acute means in this stage you remember that acute means sudden, it happens within few days or few hours, and chronic means more than few weeks and different weeks, months, years. That is the chronic. That means we can across this is the acute and this is the chronic. History will tell যে আপনার কবে থেকে ব্লিডিং হচ্ছে, কি ধরনের ব্লিডিং হতে পারে আগে যায়, what type of acute bleeding may occur. Anyone? Trauma, accident, তাহলে একটা trauma গেল, one for trauma, then একটা accident. Number 2 কি টাইপ হতে পারে? epistaxis. What do you mean by epistaxis? তোদের জানা কথা নাই, তাও বলি, nasal bleeding. Medically it is called epistaxis. নাক দিয়ে হঠাৎ করে ব্লিডিং করছে বা পড়েছে 2 দিন আগে বা 3 দিন আগে বা 1 সপ্তাহ ধরে পড়ছে। নাম্বার 2, এই নাম্বার 3, hematemesis. Very good. What do you mean by hematemesis? Vomiting blood. Yes, that may due to some carcinoma of lung, that may be some tumor in the lung, and that coming as a hematemesis. Right? Number 4. Yes. What? Hemoptosis is there. Hematemesis, almost blood vomiting is there. Hematemesis is presentation in case of ulcer, but suppose you are dealing with some band খুলে গেছে, মানে এখানে ব্লিডিং হয়েছে, মানে internal bleeding in stomach, and come with a huge bleeding. You will came across this such of patients. So that may come with the acute anemia, and this anemia will come. And then melena. Melena means bloody stool. Melena is presentation is basically bloody stool, but not in a color is not the red. It coming as a blackish stool. Why? Because this is coming from the internal stomach or any internal organ like intestine or duodenum. Suppose patient is suffering from duodenal ulcer, and from ulcer, duodenal ulcer means stomach ulcer is there, and so coming the bleeding every day is bleeding, and this stored bleeding is converted into black color when it is coming. That is blackish color of stool is called melena. So whenever you call ekdom black, ekdom chokchoke erokom black er moto korbe, patient will say that, sir, the stool is coming like black, jet black is coming. When we use the water in the pan, then its color changes into reddish. So that is a melena, and melena is important source. Je amar tale internal bleeding will be there in the stomach, duodenum, intestine, colon, whatever it may be, some bleeding is there, and continuously bleeding is there, and so on. So this is coming patients after few days. But this melena may cause is acute hemorrhagic anemia. That may present with anemia, that may present with shortness of breathing, that may be a pallor. Se janai na ki ulcer hoye ache. Presentation stay ulto. Presentation C is not coming with abdominal pain, etc., but only coming with the melena. And then we investigate the patient, that see that the hemoglobin level is less, melena is there, so endoscopy will be there, and detected the cause is ulcer. So detect for the ulcer. Kotha bolbi na. So these are the acute melena. Now chronic means excessive menstrual bleeding that may happen in every female patient, any age group, is up to the 45 years of age. Excessive periods time. Okay, so these are called excessive periods. Number one. Number two, chronic. Then, postpartum hemorrhage. Postpartum hemorrhage also acute and chronic. This is mainly the acute conditions. Chronic means excessive hemorrhage in case of excessive periods. Number one. Number two, suppose a peptic ulcer disease continuously, that happens in melena, but continuously he is bleeding from the ulcer point. That is also happen in case of chronic. Chronically there are bleeding mechanism or poor hemorrhoids, fine. সমস্যা এই ধর তুই পাচ্ছিস, শুনতে পাচ্ছিস? হ্যাঁ, দেখো তাহলে কি হয়েছে। আমি তো ভাই এসব বুঝি না, আমি শুধু জানি ডাক্তারিটা জানি, আর কিছু বুঝি না। Continuously bleeding for months and years. Excessive periods happening, তুই চুপচাপ বসে আছিস, কাউকে বলছিস না, she will come with ballot, she will come with fainting. পড়ে গেল, এরকম হয়েছে, MBBS চলতে এরকম হয়েছে, পড়ে গেছে, পড়ে গিয়ে দেখি ঠিক আছে, এটা তো প্যারো, hemoglobin is coming at 9. Then I am history taking that sir, আমার bleeding আমার 10 দিন ধরে হয় এবং আমার বাইরে হয়, আমি কোনো কারণে দেখেন, বাহ, very good, fine, fantastic. So anemia, develop into the anemia, and treatment will be gynecological problem, not the blood, the blood. So you have to detect the cause of the anemia. Until otherwise you will not treat the patient. এমন নয় এটা তো বুঝতে পারছো anemia আছে, আর obviously they ভালো করে প্র্যাকটিস দিয়ে কি আছে। No, that is why we have to understand the classifications of anemia. Anemia cause of deficiency anemia, iron deficiency anemia, folate deficiency, vitamin B12 deficiency is there. If only iron deficiency is there, treatment will be iron deficiency. I'm by regular iron deficiency. Iron level কম, iron study করে, iron level কম, খায় না, vegetarians, তারা iron is present mainly the deep green vegetables and the red beans. Remember all this. Iron is not present in case of green banana, বলি না আমরা কলা খা, যাওয়ার দুধ খা, কিছু no, not at all. Is present high amount is a deep green vegetables, and that also important. আমরা কি খাই, আচ্ছা করে কষিয়ে খাই, so is one. Iron is one. It is present in case of only the boiled. The boiled যদি কেউ খায়, that is enough. And also red meat. The red meat is presence of this. So suppose the patient is vegetarian, taking not so much iron, may present with iron deficiency anemia, or in case of children, the presence of some worms, pernicious, that also will present because absorption of iron will be less in that case. So iron deficiency anemia is a huge cause of death. So for it, vitamin deficiency and deficiency hemorrhagic anemia. Now number 3, what will be that? Number 3 will be reduction of the RBC formation. Omega. Reduction of the RBC formation. কি ভাবে হতে পারে? কি ভাবে হতে পারে? Reduction of RBC formation. কি ভাবে হতে পারে? Any idea? Bone marrow failure. Bone marrow failure হয়ে যাচ্ছে। Bone marrow failure আর পুরো এক্সপ্রেস তৈরি হচ্ছে না। Any cause. আর the cause of that may be the aplastic anemia. That may be the aplastic anemia. Aplastic anemia. এইগুলো যদি পুরো একদম মুখস্থ করে না বলা তা না। I am giving just idea what is happening in case of classifications. So aplastic anemia means bone marrow failure due to primarily or secondary causes of some disease or some task. Suppose a patient is a cancer patient taking the methotrexate is a chemotherapy chemo and is taken. But a patient is long-term phenytoin one drug that is used in case of convulsion and is used for long term, 3 years, 5 years.
Maybe the number. And that patient may come with some sorts of pallor and hemoglobin level is formed. That is a reduction potential to decrease the production of the RBC from the bone marrow. That is a failure. Bone marrow failure is there. It's happening in case of aplastic anemia. And in case of some acute hemorrhagic disorder, বা বলতে পারিস acute disorder of chronic disease. কিরকম? দিসগুলোর নাম হলো জাস্ট malignancy. একটা পেশেন্ট অনেক দিন ধরে হচ্ছে malignancy. Patient is suffering from hypothyroidism. এটা হচ্ছে hypothyroidism. কেন? Thyroxine is a stimulator of the erythropoiesis. It's a hypothyroidism. Now, rheumatoid arthritis, chronic inflammation. Chronic inflammation means iron level will be less. In case of any chronic inflammation, iron level will be less and iron will not reach to the bone marrow to form hemoglobin. If hemoglobin is less, then iron inside the hemoglobin will be less, and so the carrying capacity of cell will be less, and the result will be anemia. Because anemia is represented by decreased oxygen carrying capacity of RBC. Right? So, this main presentation is a chronic disease like malignancy, hypothyroidism, rheumatoid arthritis, and SLE. SLE को काफी सारे details से होते हैं. SLE मान लीजिए the systemic lupus erythematosus disease in the case of female. And connective tissue disorder. Don't remember now. It will come day by day. You can across. So there are different types of chronic disease they cause such type of anemia. Number four. Some genetic disorder. Some genetic disorder may cause anemia. যেমন সাইডের প্রবলেম হয়ে যাচ্ছে। That means RBC cytokine calling the proteins spectrin, ankyrin, band 3, band 2.1, band 4.2, 4.1. These are the cytokine protein. If any of this protein is changing and mutation is there genetically, that means hereditary spherocytosis, hereditary erythrocytosis, hereditary stomatocytosis. So genetic cause. Genetic cause will be first of all coming as a genetic mutations of some proteins like ankyrin, spectrin, RBC. So then this will come as hereditary spherocytosis, hereditary erythrocytosis, hereditary stomatocytosis, stomatocytosis. These are the coming now. Thalassemia, genetic sickle cell anemia. তাহলে কি হলো আমার গ্লোবিন স্ট্রাকচার is problem. Globin structure is problematic means thalassemia will come in case of there is also already thalassemia, sickle cell anemia, it will come as this. Another case is enzyme deficiency. Enzyme deficiency. One or two enzyme deficiency is important for you. That is the glucose 6-phosphate carrier. আমি এটা এখন বলতাম না, but this will come in biochemistry also. But remember this, on the A class that will come as some enzyme deficiency will be there. Enzyme deficiency মধ্যে দুটো one X G6PD glucose 6-phosphate dehydrogenase. Now the slow molecule. And another is pyruvate kinase. If this happens, একটা example is, suppose you are dealing with the malaria, right? Now malaria for a treatment which is prophylactic, that is very तरह से कुछ हम लीजिए का is suppose malaria, primarily to the branch. Yes, primarily is given by seeing the report of glucose 6-phosphate dehydrogenase specifically in male, because this glucose 6-phosphate deficiency, glucose 6-phosphate dehydrogenase enzyme deficiency mainly seen in male, not in female. Pyruvate kinase is very rare. If you forget, glucose 6-phosphate deficiency important because it has helps to reduce the free radicals during our disease process. Any disease, suppose you're suffering from pneumonia, suffering from some viral infection or toxin, your free radicals continuously is happening in our immune body. What is happening? Glutathione. That's why I'm not coming in this process because there is a huge thing is there. It will come to the biochemistry, the biochemistry part, but still you remember that glucose 6-phosphate dehydrogenase deficiency is dangerous for any patient or any people, any person having some stress. আমার বড় উদ্দেশ্য এটা যদি কোনো পেশেন্টের আমি জানি না আমার পেশেন্টের ডিজিজ আছে এমন কোনো কন্ডিশন হলো যে আমরা বাজে নিউমোনিয়া হলো and that is some formation of some stress and that causing some free radical formation and now this free radical formation will be demolished by this enzyme by some process is there but I have glucose 6-phosphate deficiency করতে পারবে না I may die also by the hemolysis এটা হয়েছে this happens before giving the pineapple and do some extra many drugs are there that precipitates the glucose 6-phosphate dehydrogenase deficiency. If already is there, that may precipitate into the acute hemolysis and death. So that is why that's important and I emphasis on this. The glucose 6-phosphate dehydrogenase to test kora. Our deficiency আছে before giving some specific class. যারা এগুলো জানে যাতে আমরা প্রেসক্রাইব করতে তারা যাবে if I prescribe child in pineapple then I definitely go for investigation in case of specific disease. Before going into the go for the taste and I'm giving pineapple and the baby diet, our licenses. Simple thing, I mean the literal thing, and the parents did not do that taste, no problem. For their huge loss, I have no problem. Because I have written. So you have to written after your knowledge. तो যদি না জানা থাকে তো কোনে নিয়ে কে জানে কি জানে no that is the clinics that is the beauty of clinics and due to the clinician the কোনো জিনিস মিস করে no miss policies and day by day when you are going to practice very difficult for you legally ethically practice is must and if you want ethical practice and rational practice knowledge must be there otherwise no it is there so genetic cause is there কি বললাম genetic cause কি বললাম একটা বললাম RBC প্রোটিনের মিউটেশন হচ্ছে এটা স্পেরোসাইটোসিস ইলিপ্টোসাইটোসিস somatocytosis and then again the structural problem of protein thalassemia sickle cell anemia will be there but details will be there in later classes and then enzymes it is glucose 6-phosphate dehydrogenase deficiency pyruvate kinase deficiency okay and now another cause is there that is a acquired cause means autoimmune diseases naam bolo na just autoimmune diseases some toxin somewhere kamleche same that may cause hemolysis সেই কি বলা হয় নিউরোটক্সিক ভেনম বলা হয় একটা নিউরোটক্সিক স্টেট আছে এই কিছুদিন আমি আমার বাড়িতে গুগল করেছি নাকি আমি অবাক গোগ্রো মিন্স নিউরোটক্সিক মারবে এত মোটামুটি আধা ঘন্টার মধ্যে শেষ so these toxins responsible mechanical what do you mean by mechanical suppose the patient is having some heart valve heart valve লাগানো হয়েছে অনেক বয়স্ক দাদু ঠাকুমা তাদের লাগানো হয় this mechanical heart valve always is come to across the RBC and RBC is that mechanical cause and also some infectious cause means any infection may cause so in case of etiological classification deficiency hemorrhage genetic cause reduction of RBC and also the acquired cause এটাই হচ্ছে etiology right in case of morphological just come today I will give some terms please silent so term is for the morphological classifications number one is normocytic normoclonic number two microcytic hypochronic. Number 3, macrocytic hypochronic বা normochronic. Number 4, dimorphic anemia. So these 4 are the morphological classifications. Morphological classification is based on hemoglobin, MCV and MCAC. MCV means volume of 1 RBC and MCAC means amount of hemoglobin present per unit volume of RBC, not count. So these are the normocytic normochronic. What is so important? Blood test morphologically. These are the normal. What is the meaning? First of those cause already আমি বলে দিচ্ছি অলরেডি। তাও আমি আরো বলছি। নর্মোসাইটিক নর্মোগ্রাফি পড়বে হচ্ছে হেমারেজিক ব্লাড। মানে হেমারেজিক বা হেমোলাইটিক ব্লাড। হেমোলাইসিস হচ্ছে। তো এই ক্লাসে কি নাম? তারপরে গ্লুকোজ ডেফিসিয়েন্সি এগুলো সব পড়বে নর্মোসাইটিক বা অ্যাপ্লাস্টিক অ্যানিমিয়া বা অ্যানিমিয়া অফ chronic disease chronic disorder. All are I will discuss in details in next class. But still remember all of the causes here is discussed. Because classification anyone you can do. When you are in clinics, you can whatever you feel comfortable, you can go for it. I am comfortable with this last one. I diagnose each and every anemia cause to see this very easy because I have the CBC. CBC means RBC is there. If RBC is there, that means 2 values are there, MCV and MCS, and I will detect. Otherwise I will have this plan for my investigation process. Suppose a patient will come in with microcytic hypochromia. I know the microcytic hypochromia means either iron-deficiency, thalassemia, or anemia of acute inflammation. Acute anemia with chronic inflammation. That means chronic disorder is there. মানে তিনটে আমার মাথার মধ্যে হয়ে গেল। তাহলে মাইক্রোসাইটিক হাইপোক্রোমিয়া মানে কি? এমসিপি কি হবে? কমে গেছে। হ্যাঁ? এমসিএসি কি হয়েছে? কমে গেছে। হ্যাঁ? হাইপো means কম, মাইক্রো মানে ছোট। আরবিসি ভলিউমটা ছোট হয়ে গেছে। ঠিক আছে। If RBC amount is small, that means RBC থাকে না। ঘোড়াটি থাকে কি বল? ঠিক আছে। Hemoglobin is less. If hemoglobin is less, that means oxygen carrying capacity is less. So microcytic hypochronic anemia and also in written in CBC also. You need now বুঝতে চাস কোন লিখিত দেখে। This is microcytic hypochromia. That means I have to think clinically cross-check whether we are dealing with patient with thalassemia, whether the patient dealing with iron-deficiency. If there is a spleen, suppose after 6 months, the spleen liver is there, and some pallor is there, jaundice is there, and hemolysis is going on, and then we suspect for the thalassemia. That's the patients. And then go for the HbA1c test. That means come later. HbA1c test means high performance glucose test to detect the thalassemia. It detects clearly. It says that yes, this is coming from alpha thalassemia, beta thalassemia, etc. So after seeing only the CBC report, you can approach your case. You can approach your diagnosis. You can plan for the investigations. So this morphological is clinically important because this microcytic macrocytic macro key red blood cell cannot. Normally red blood cell is decreasing because already I told you that the pro-erythroblast size is 20 micrometer, but RBC naturally size is 7 to 5 or 7 to 8 micrometer. That means decreasing. So why it is increasing? Because there is no question of any DNA condensation. And for the DNA condensation, which important proteins must be there? Vitamin B12 and K8. So these deficiency cause macrocytic. I will discuss in later class, next class, Up to this, dismiss my class. Thank you very much.